It'll tell me when it starts. Okay, so it looks like we're good and we're recording. So again, welcome everyone. Good afternoon. Today we're going to talk about mobile device security. And slide 1. Always a technical difficulty at the beginning, right? Okay, there we go. So the HIPAA privacy rule. I think we all know that HIPAA requires that all protected health information, or PHI for short, be safeguarded against threats to security, integrity, and unauthorized use. The HIPAA security rule applies only to electronic PHI, or protected health information. This is in contrast to the privacy rule, which applies to all forms of protected health information, including oral, paper, and electronic. There are 3 parts to the security rule that covered entities should know about, and we'll discuss those today. The first is administrative safeguards, which includes items such as assigning a security officer and providing training. Also, physical safeguards. This includes equipment specifications, computer backups, and access restrictions. Also, technical safeguards, and we'll address all of these subjects in the discussion today. We also should be aware of individual state laws, and sometimes those laws supersede the federal law, and they're a little more stringent. So your organization should that you're aware of these. The Medicare conditions of participation also address information security. So again, your organization should be aware of all of those things when it comes to mobile device security. The Department of Health and Human Services really listened to you. Health and Human Services conducted a mobile device roundtable in March of 2012 and held a 30-day public comment period to identify and gather the tips and information that would be most useful to healthcare providers and professionals that were using mobile devices in their work. You can access that information at the following link that I have here on this slide, and they really do have really great information that's very helpful on their website. Whoops, we missed one here. Hold on here, we keep missing a slide. That's okay. I'll just go ahead and speak about it. So in regards to you, your organization, and your mobile devices, does your organization have a mobile device use policy? If an organization allows providers and professionals to use mobile devices for work, then that organization should have reasonable and appropriate mobile device policies and procedures. The policies and procedures should describe any configuration requirements for mobile devices used by providers and professionals for work. Additionally, does your organization allow you to use your personally owned mobile device for work? So you might have heard the term BYOD, which means bring your own device. Bring your own device refers to using your personally owned mobile device for work. If you do use your own device, you should let your organization know you want to use your personally owned device. Many organizations have centralized security management to make sure that mobile devices accessing their internal networks or resources are compliant with their security policies. Centralized security management includes the configuration requirements, such as installing remote disabling on all mobile devices, It's also management practices such as setting policy for individual users or a class of users on specific mobile devices. Do you know who your organization's privacy officer and security officer are? It's really important to know what to do and who to contact when a mobile device is either lost or stolen, or in the event that you suspect health information has been compromised. The HIPAA privacy rule standard for personnel designation requires a privacy officer. A security officer develops and implements policies and procedures required under the HIPAA security rule. And your organization can have either separate privacy officer and security officer, or it can be the same person. Also, does your organization require you to register your mobile device with the organization? So registering your mobile device with your organization will allow your organization to control who has access to the network or system, and it can keep unauthorized persons from accessing its network and system. So registering your mobile device with your organization can really be helpful for your organization or even for the police to find your mobile device if it's lost or stolen. So you're definitely going to want to contact your organization's privacy officer or security officer to register your mobile device. Does your organization have a VPN or a virtual private network that allows you to access, receive, or transmit health information securely with your mobile device? A VPN is one way to create a secure connection even on a public unsecured network. A VPN provides security in an unsecure environment. So the connection between your mobile device and the server is encrypted. So information you send or receive is protected due to the encrypted tunnel established by the VPN, even on an unsecured network. VPNs can be established over all internet connectivity options. The risk of using a public Wi-Fi access point or a hotspot or public wired internet connection, like a hotel or an airport or even in a hospital, allows an interception between the mobile device and the system connection. A VPN allows secure remote access from a mobile device to internal resources such as your hospital network and system. This protects the data from unauthorized access while being sent over the internet using an unsecured network. So that VPN establishes a secure private connection by encrypting data from the mobile device to the connected system so it cannot be intercepted. Additionally, does your organization have a policy about storing health information on your mobile device? Due to their small size and portability, mobile devices have a higher risk, obviously, of being lost or stolen. And if you store unsecured health information on a mobile device and the device is lost or stolen, obviously then confidentiality and the privacy of that health information that it holds can be compromised. Does your organization require you to back up health information from your mobile device to a secure server? If you're allowed to store data on your mobile device, it's a really great idea to regularly back up that data to their secure server. And if you regularly back up that data and the mobile device is lost or stolen, at least that data will still be available on the secure server. Does your organization require you to enable remote wiping or remote disabling on your mobile device? Remote wiping is a feature for lost or stolen mobile devices that remotely erases all of the data on the mobile device. Some mobile devices have built-in remote wiping capability that the organization or authorized user can enable. Remote disabling enables you to lock or completely erase stored data on your mobile device if it's lost or stolen. And if the mobile device is recovered at some point, that data can still be unlocked. And lastly, does your organization offer mobile device privacy and security awareness and training? So providers and professionals who use mobile devices to access, transmit, receive, and store health information truly do need security training specific to mobile devices. Privacy and security awareness and training should really be an ongoing part of the provider and professional's work environment. So to get back to our slides here, what is a mobile device? So I think most of us, for the most part, really kind of think about, their mobile device as, really just their smartphone, but really it's all of these things. It's your laptop, it's a USB thumb drive, your external hard drive, your tablets, your iPads that so many people are working on today, even something like your Kindle. And I think we all know that technology just supersedes anything that most of us even think of. So, how many other things are in the works that we don't even realize? So what are some risks to know about before using a mobile device for your patient care? A lost device, a stolen device, inadvertently downloading of a virus or other malware. And some of those things really can come over in something, especially if you're using your personal device for work. Just clicking on one simple email can completely destroy your entire phone if it has a malware on it or a Trojan horse. It's horrible. Unintentional disclosure of unauthorized users when sharing device with, friends and family. And I've seen it myself personally. I've been in a doctor's office and, I'm seeing the doctor doing work, and he happened to have his son in the office that same day, and the son said, "Hey, Dad, can I play on your phone?" And sure, he handed the device over to his son, and the son said, "Oh, gosh, what is this picture of?" And, it was a slide of someone's results. So, really just taking care of that PHI. Obviously, another risk is an unsecured Wi-Fi network, and just making sure, maybe getting use of those VPNs that we touched upon a few minutes ago. So what are some activities that make devices vulnerable? Software downloads. I know not that long ago, the new update of my iPhone went ahead, did the update, and, sure enough, the organization came back and said, we have to shut down everyone's access to their email on their company cell phones. Something within that new iOS update made it so our emails were not as secure as they should be. So we disconnected it. And then as soon as Apple released another update, sure enough, we were okay. But really until then, most of us had done that software download and not even realized that we were in danger. Visiting malicious websites. Sometimes we don't really think about that, even when we're logged out of things, then going into a separate tab and going into something else just really opens up our mobile device. Obviously, there can be a direct attack through a communication network. It does happen, and physical attacks. So some common sources of threats to our mobile devices or the PHI on them. Botnet operators. Bots can be created to perform malicious tasks that compromise the system or any information stored on the machine. The bot in botnets refers to bots that can be used by an attacker to hijack or control a computer system. These malicious bots can arrive on a victim machine in many ways. The most common method involves dropping the bot in a Trojan horse or similar malware. Other methods include infecting the computer via a drive-by download or distributing the bot via spam email messages with infected attachments. Once installed, the bot can take control of the system. A remote hacker can then give commands to the infected computer via the bot and force it to perform malicious actions. In this context, a bot is very similar to a backdoor program, which is also forcibly planted on a computer and used by a remote attacker to direct the infected machine. Cyber criminals, I think probably we've all heard the story about Target and, you know, what happened with their software. Cyber criminals, they select computers as their targets, and these criminals attack other people's computers to perform malicious activities like spreading viruses, data theft, you know, and identity theft. And obviously a hacker, a person who, you know, uses a computer to gain unauthorized access to, you know, someone else's data. So other topics and risks to consider. You know, device ownership. Is it your cell phone that you brought into the organization, or is it organization provided? Typically, if the organization is providing you with a cell phone or a laptop, you know, they're going to have that locked down a little tighter than if it's your own device and you're just accessing their system. So an organization really needs to consider what's best for them. Is it better for them to go ahead and hand out those company phones and make sure that, you know, everything's okay? The location when using your mobile device. Is it your home? Is it at a hospital? Is it in a public place? And just making sure, you know, where are you connected? If you are somewhere public, are you using a VPN? How are you accessing that information? And can anyone corrupt or intercept that information? When you're communicating with patients, are you using a patient portal? Are you just calling patients? Are you texting with patients? So actually the way that we communicate not only with each other and with patients, you know, is really vital, and how we're communicating with them and how that information is being transmitted. So Bluetooth capabilities, if you have that turned on, you're transmitting things, you know, out into that stratosphere. So when you are on either your HIE or EHR, shutting down that Bluetooth capability. When accessing your EHR and your health information exchange, are you using a VPN tunnel? Is it secure? What do I do with my old device? The securities rule even addresses what you can do with your old device when you're no longer using it. So that old laptop that you're updating, that old cell phone that you're updating, if it has access to an EHR or an HIE, you know, what's going on? What can you do with that old device? What do you have to do to secure it? Oh, waiting for my slide to update here. My presentation isn't cooperating. I apologize. One more, okay. How can you protect and secure your ePHI when using a mobile device? So we can use a password or other authentication. You know, in our company, if we have any information on our cell phone, we immediately have to have a password secure our cell phone. You can install and enable encryption software. You can install and activate remote wiping and or the remote disabling that we spoke of before. You can disable or not install or use file sharing applications. Install and enable a firewall. Install and enable security software. Make sure to keep your security software up to date. And research mobile applications before downloading them. We all like to go out to the iTunes store and the Play Store and download things, but really we should be taking care in what we are downloading and pay attention to what files it says it's accessing. So what do you do if you suspect there has been a breach? Well, there is a breach notification rule right in the HIPAA guidelines, and they state that you need to immediately contact your privacy officer and follow your organization's mobile device policies and procedures, and make sure you contact that security officer right away. There is a really great video out on the Department of Health and Human Services website. I have added it to the PowerPoint. When the PowerPoint is uploaded out on YouTube, you'll be able to access that and you can watch it. It's just a really quick 4-minute video, but it has some really great information in it. So I did include some really helpful links that you guys can go out to regarding the privacy rule, the security rule, healthit.gov. I also included my sources for the information I obtained for my PowerPoint out at AHIMA and understanding your organization's mobile device policies. So these links were really helpful when I was compiling the information. And if you guys have any questions, you can go ahead and pop them in the chat window. And I can unmute everyone and see if anyone has any questions that they'd like to send to the group. And that's okay. So I do have a question that came through the chat window. What is your experience on how well the providers are aware of the HIPAA privacy and security to protect PHI? I can honestly say that most of the providers that I have dealt with in the last 10 years, really most of them are very concerned with making sure that their PHI is protected. There are some who are very diligent in making sure that they're doing what they're supposed to do. I think most of us do. Unfortunately, I have had, like in the example that I used, with a provider who wasn't as cognizant with his PHI as maybe he should have been, and unfortunately, as much as probably none of us really want to say it, it does happen. It does. It's sad but true. So obviously we don't want to reflect as much on the negative. We like the fact that most people really do want to make sure that they're keeping their laptops secure and they're keeping their cell phones secure. But yeah, it's true. There are some providers who probably aren't as cognizant about the privacy and security rules and protecting that PHI as they should be. And so really I would like to see, you know, a lot more seminars, you know, geared toward not just the staff, not just toward your RHITs and your medical records department, but really toward your providers too, to say, hey, you know what, this is important and everybody needs to know about it. Are there any other questions? Okay, here's another one. What has been the timeout setting for mobile devices? I think ours is set to about a minute. So I don't know. I am not sure. I certainly can investigate and get back to you if you want to send me your email address and see if there is something that speaks specifically to a certain timeout period. I would think that it would be pretty short. And I know that when it comes to computer software, you know, the EHRs, that typically there is a best practice that says once you've been away from the screen for X amount of time, you know, we do make you log back in. And usually it is pretty short. So again, I'm not exactly sure if that is exactly spelled out or if most people just do go with the best practice, but I will certainly investigate and get back to you with that one. You're welcome. Can anybody else think of anything specifically that they'd like to ask? Again, those links that I posted and that are on the PowerPoint really are full of really great information. Even as I was researching for the presentation today, you know, I expected that, you know, sure, there would be, you know, some information out there and a lot of it would be a lot of legal jargon, but believe it or not, there was so much information out there. There really, really was a lot. So if it's something that you guys are really interested in, and I found it very interesting. So if there's anything that you're interested in and have specific questions on, those websites and those links really, really were very helpful. And again, I have my information up on the screen. I'm Sarah Batista. If anyone has any specific questions in particular, and there's anything that you'd like, you know, for me to research for you, you certainly can contact me, and I'll help you as best I can. And I'll throw it out there one more time just to see if anybody has any additional questions. Okay, if nobody has anything else, thank you so much for joining Court Healthcare today and our discussion on mobile device security. Again, we recorded the session and we're going to go ahead and put it out on YouTube if you guys want to look for it, and any of our other presentations. We do these once a week, so if there's any other topics that you're interested in, just, you know, shoot them out to us and say, hey, maybe you guys can talk about, you know, this in the coming weeks. We would certainly love to hear from you and any suggestions for anything that you'd like to hear about. So thanks, and everybody have a great afternoon.